Dr. Mehrotra, as a cardiologist, are you seeing more patients who appear healthy on the surface but they end up having serious cholesterol issues? Or is heart disease risk only showing up when they go for testing?
We are in midst of a tsunami of non-communicable disease.
You're calling it a tsunami, sir?
Of course, it is. The two biggest health challenge at this moment are non-communicable disease and the climate change. More than 70% of morbidity and mortality because of cardiac this non-communicable diseases. What we are discussing today is only part of the problem. Cholesterol is one part. But the important thing is keep change in the lifestyle.
Right.
Such Asian, South Asian phenotype entity is there, where we are more prone for developing cardiac problems because of there are different factors for that. But it is not the only thing. The change in lifestyle, we have to look into our what we are eating, how much exercise we do, how much time we sleep. There are studies. In the last 7 years, there is 3 times increase in the incidence of heart disease from 1,300 per lakh to roughly 3,900 per lakh. In the last 7 years only, it was said that heart attack affect the people in elderly age, but not so in India.
Yes.
More than 25% of patients who present as a heart attack are in less than 40 years age group. And as the time is passing by, age is further coming down. We frequently see patients in 20s in our wards and CCUs with a heart attack. So it is really a catastrophe which is happening.
Lens, Dr. Mehrotra, have we gone after treatment rather than prevention? Heart disease is already India's leading killer. It accounts for nearly a third of all deaths, as we are reporting. But are we still largely treating heart attacks after they occur rather than preventing them in the first place? And does public health policy need to kind of change to be able to get the prevention out first?
That is the crux of the problem. We have got the best of the treatment, but we have to look which is the population which is getting affected. I was listening to the discussion. It is a lower socioeconomic status persons. Most of the persons who migrate from rural area to urban areas, they are the person who are getting most affected. They don't have the financial means to get them checked up. They don't have the time because if they go for the checkup, they will lose their day's wage. So we have to build a robust preventive program. That is what is the need of the hour. Government has started doing something regarding that. We need to screen those persons at the site where they work for the various. There is a thing about cardiac profiling where we are into that. We are a very large program, non-communicable disease elimination program. We are doing that. We go there to the site with our medical van. We do all the relevant checkups and the examination of the patient, and we profile them according to the risk, whether they belong to high risk, medium risk, or low risk. And I remember sharing some data which is for the study we are going. Almost 70% of the persons comes in the high or medium risk group in India, in that particular population, those who can't afford the treatment. So problem is there. What is the problem? Processed food and digital addiction. These are the two things which is causing the problem.
Right.
So there is a data. We are eating more than 11.5 lakh crores of processed food every year.
Correct.
More than 5.5 lakh crores of food outside home. So these are the one. Which type of food are we eating? This is not the food meant for our genes. We are not compatible with that. And it is that is leading. Other thing is this pollution, climatic changes. There are two things. You should have right kind of food to eat and right kind of breath to breath. It is
So we don't have the right kind of food to eat and we don't have the right kind of air to breathe. These are the fundamental lifestyle issues that we are facing.
We are not fit. And we don't do anything to remain fit. Most of the time we are fit.
So our lifestyle is not likely to change immediately, Dr. Mehrotra. The kind of cities that we live in, the kind of infrastructure problems that we face on a day-to-day basis, the way people travel in Mumbai, all of that remains a constant. We're talking about the monsoons, how it kind of sends the entire city into a havoc. And of course, we've seen how diseases really grow during this monsoon time as well. But, you know, that's a lifestyle issue that isn't going away. But then if you are looking at prevention, then at what age should routine cholesterol screening ideally begin for Indians? Is the old belief that screening can wait until middle age, is that now outdated?
No. The problem starts from the teens itself. type of food the children are eating nowadays. There is recommendation from the American Heart Association ACC that first screening should be below the age of 2 years, to detect in the particularly in the children who are born to having history of premature heart disease and familial cholesteremia. Thereafter, each and every child should be subjected to lipid profile at the age of between 9 to 11 years to assess the risk for the cholesterol problem, later on, which can later on develop into a cardiac problem. Thereafter, at 19, at the age of 19 and thereafter at every 5 years, one has to be screened for that. So it is at 0 to 2 years.
Yeah.
Then 9 to 11 is mandatory for everyone there.
Right.
It is more so with India. It is more so with India.
So, Dr. Mehrotra, since we are talking about popping supplements as opposed to having the natural foods and having the fiber the natural way, there is often this confusion around the medication. At which point should people focus on lifestyle modification, and at which point should they seriously consider, these supplements or even undergoing medical treatment, of course, under expert guidance, but still?
This is the topic which has to be answered by a specialist. For that purpose, one has to consult a doctor. I would like to raise one thing about the prevention. I would like to congratulate Government of India that in the newer labor code it has incorporated that every person over the 40 years should be screened for health problems. This is now become mandatory for each and every factory owners and other establishment, and this is now mandatory. That is a very big step in the direction. With regards to the diet and what is good life, what is balanced life, that we have to learn about that. Which type of food we have to eat. We all know what we have to do, but we are not doing that. Problem is there. The other problem is many of the migratory population which lives in the cities, they don't have the means to eat the right food. They don't
Yes.
have time to buy the meat. They have to breathe in the air which is not worth living.
Yes.
This is something which is causing problem. This thing can only be addressed by government.